My name is Shahrier Sarker, and I'm a consultant orthopedic hand and wrist surgeon. I decided quite early on to become a doctor, as my main inspiration was my grandfather, who used to be general practitioner back in Bangladesh. And on holidays, when I spent time with him, I used to see patients coming in to see him on weekends, looking quite full on and upset, and they would leave with a smile on their faces. And that really inspired me to be able to make a difference for people. When I was in medical school, trauma and orthopedics was the one subject that made a lot of sense to me. I had a strong background in physics and maths, and my father was a mechanical engineer. So trauma and orthopedics just seemed like a natural disposition to me, and I really enjoyed it. And the fact that patients come in unable to walk or with pain, and you can make a quick difference to their quality of life. With regards to hand and wrist surgery, I find that anatomy absolutely fascinating. People don't realize how important their hands are until they've suffered an injury, and it really, really is disabling. And I like to be able to make a quick difference to that. Apart from that, the wide variety of surgery keeps me on my toes, and there's always something new and challenging around the corner, which I really thrive and enjoy. The thing I find most rewarding about my job is that I can make a difference to the patient's quality of life and give them back function and freedom, really. I've had patients come to me who could not do their hobbies, could not do their gardening, and after their surgery, they can actually go back to all of these things. And the fact that I've been able to do that really gives me a lot of joy in my job. I think my patients value the fact that I'm quite candid and honest. I like to explain things in simple terms that they can understand and not use medical jargon, as that only complicates things. I like to be honest as well about what their condition entails. And I'm quite detailed in terms of all the different treatment options that can exist for one particular condition, from doing nothing to complex surgery. And I like to start the journey with them at the beginning and take them through the whole journey and be there with them. And I think what I value most about my patients is that they like to come and see me. They like to spend time talking to me. I'm a good listener, so I will always listen and give them my full attention. And I'm always there when they need me. Unfortunately, I don't have any catchphrases, but in terms of mantras, yes. I believe that every patient needs to be listened to, and I believe that every condition and treatment needs to be explained clearly. And when it comes to operating, I always do things the same way so that I don't get complacent and I don't miss any particular steps. And that always reminds me that I'm doing the things correctly and I give my best to the patients.